What is Wharton's jelly and why do we want to inject it to promote healing? I'm Joya Van Der Laan. I'm a family nurse practitioner, board certified, and I help people live longer, healthier lives, and also now pain-free and functional lives. So what is Wharton's jelly? It's actually what composes the umbilical cord, nice and squishy, yet also really durable, has to withstand a lot. And so these are collected from born babies who go home with their parents, so no sort of ethical issues there. But we can purify that, not we, my specialized, highly specialized labs, purify that, test it highly. The lab that I use even tests for COVID spike proteins in that, and will not use it if, of course, it does turn up positive. So we can inject these into areas that need help healing. So injured areas, inflamed areas, areas of pain. And it causes a regeneration of the tissues and a de-inflammation or anti-inflammation of the tissues, which leads to healing and pain relief and return of function. And so often in a knee or a shoulder or a hip or an elbow, for example, we can restore the normal function because we've restored the normal tissue. And one of the really big benefits of that is not only pain relief and return of function, but often avoidance of a surgical procedure that would otherwise be needed in order to repair those tissues. If we think about Wharton's jelly, it's nice and cushiony, again, so soft, but also, again, really durable. And it has all kinds of healing factors and collagen and high hyaluronic acid, chondroitin, even immune factors and healing factors, certain immune factors that promote healing. So really injecting this into the joint is one of the best ways that we can promote cartilage healing, anti-inflammation, and immune sort of regulation within the joint to provide an environment for healing. Wharton's jelly also contains what are called MSCs, or medicinal signaling cells. They used to be called mesenchymal signaling cells, mesenchymal stem cells. So MSCs, the definition or wording, I suppose, of that has changed over time to become more accurate. But these are really potently powerful healing cells, essentially, that signal the body to heal what's broken. It's pretty amazing. One of the reasons why I love to use the products from Wharton's jelly or from amniotic fluid is because I know it's sourced ethically. These babies are going home with their parents, no issue there. But also because these are the very youngest stem cells or regenerative products that we have. When we harvest stem cells from a 30, 40, 50, 60-year-old, those are older cells and have been exposed to the toxins that you've been exposed to your whole life. So using your own cells is not my preferred way to go about doing things. Plus, it's another procedure. We've created inflammation at the harvest site, whether that's a fat or adipose harvest site or a bone marrow harvest site. Now there's inflammation there. And what we know about these stem cell products, regenerative products, whether it's peptides or amniotic fluid or PRP or stem cells like this Wharton's jelly product, they are attracted to sites of inflammation. Now, if I'm trying to inject your knee and I've just created inflammation from a bone marrow or a fat harvest, some of those cells are going to be attracted, instead of to your knee, to that area of inflammation. We don't want that. The biggest area of benefit for the Wharton's jelly products is joint, anything joint related. So torn labrums, meniscal tears, cartilage degeneration, so anything arthritic, any ligament or tendon tears. To a degree, we want to make sure they're not fully torn, of course. There's a point at which you just do need surgery, and then we can do the stem cells later. But really, joint applications are the biggest benefit for Wharton's jelly. Any kind of regenerative product is going to work best in an optimal environment. And so what do I mean by that? Part of the reason why I'm offering regenerative services in a functional medicine practice and why that fits really nicely together is because when I can optimize somebody's hormones, decrease their baseline level of inflammation, make sure their toxic load is not too high, make sure they're eating a healthy diet, exercising, sleeping, getting sunlight, the regenerative products that we use are going to have the greatest potential for benefit. I explain it like this. If I were to throw grass seed on concrete and water it, Some of them probably would sprout and maybe grow for a little while. It's really not the best environment. So if we are injecting stem cell products, regenerative products, into a less favorable environment, we really can't expect full benefit from them. Now, if we prepare the soil and put fertilizer on it and put water on it and make sure the minerals in that soil are all optimal, and then I put grass seed down, that grass seed is going to thrive. So just like if our environment, our soil, and our body is optimal, once we inject that grass seed, the Wharton's jelly, the regenerative product, into the body, that is the best chance of those regenerative products, whatever it is, working as good as possible. Now, these things are not cheap. And so I always want to make sure too that the investment is protected, is a wise investment. And if you are paying me to do these regenerative injections, I want them to work too. It doesn't feel good for me when they don't work. So I always want to optimize somebody, ideally before or at least in the few weeks and months after injections, to make sure they work as well as possible. Now, this was a slight overview of Wharton's jelly, and I'm sure there are other questions. I know there are other questions that I haven't addressed. We do offer free discovery calls for patients who might be interested in these services. So I'm happy to talk through a little bit, answer any questions, even go over things like pricing and schedule of injections, whether it's one or multiple. So you can book that discovery on our website, nourishhousecalls.com, and I look forward to speaking with you.